Okay, so for this week's discussion, we are talking about prescription drug use. So I'm going to talk to you about some of the stuff I read about. Um, the first question was, what assessment findings, physical, verbal, and nonverbal, and psychosocial, may indicate substance abuse related to opioid use? Um, and why do these occur? There are a couple different assessment findings that can indicate substance abuse in relation to opioid use in particular. I think in the beginning it mentioned Vicodin and Oxy. Um, some common physical findings are often um, a decrease in respiratory rate, pinpoint pupils, nausea, constipation, slowed or slurred speech, sleep deprivation, slowed gait, dry, itchy skin, and constant flu-like symptoms. So those are kind of the common symptoms that we see, especially if people are abusing them. A lot of times if, someone just took a normal, I guess, prescribed amount of the drug, you won't always see those things unless they're having a reaction. But the most common things that we see, especially that I've seen, are the decreased respiratory rate, the slowed or slurred speech, definitely the kind of slowed gait. I haven't seen the pinpoint pupils before, but I don't know that I've actually looked specifically for them. Um, and so I found those on a website that was entitled Warning Signs and Symptoms of Drug Abuse. Um, let's see. So Vicodin and Oxy are both opioid antagonists. What they do is they stimulate certain opioid receptors located in the central nervous system, like your brain and your spinal cord, and they bind to those receptors, and then that leads to a relief of pain and a sense of euphoria in different receptors in the body. And if too much is taken, those same receptors are what cause all the other symptoms that I talked about above. You're blocking those receptors. So that's kind of like how it actually works. Um, the next question is, what behaviors do patients demonstrate when abusing opioid medication? So a lot of times you'll see someone acting really irritable, having a negative attitude, slurred speech, personality change, or sudden mood changes were the first things I thought of, and that when I looked it up, I kind of came across pretty much the exact same behavioral patterns. Um, Especially if a patient is like withdrawing or wanting more of the medication or something like that, then you definitely see these behaviors come to play. I had a patient, one that stands out in particular, which I'll talk about a little bit, but to go along with this, she took her own opioid medication from home when she was in the hospital that she had hidden from us. Um, and she kind of displayed all of these things. She was also difficult to arouse, which first indicated it to me, but she was very irritable with me like the whole day. Her speech was kind of funny. I had stopped her pain medicine that I was giving her because I thought it was just a reaction to that, but turns out she was overdosing on her own medication. Um, and those behaviors are the same reasons that people can have vital sign changes um, and like physical appearance changes because the opioid receptors, um, it's the kind of the same deal. Um, the opioid receptors are stimulated and drugs bind to the receptors, and then it causes that euphoric feeling or an overdose, which then puts you in like a high state of mind. Um, and then when patients start kind of coming off that high, you'll see really strange behavior patterns. They might feel like they need that high, and they'll start acting just angry and all kind of different sorts of things that you will see. Next question was, identify best practice interventions that healthcare providers may implement to manage prescription drug abuse and or addiction. Provide a rationale for your response. And in clinical practice, how do you address these possible substance abuse situations with your patients, and what dilemmas have you encountered? Okay, so I feel like as a nurse, there's only so much you can really do in an acute care setting, like working in a hospital, which is where I work, to help manage prescription drug abuse and addiction. They're there for a short amount of time, and you don't really have that much, I don't want to say power, but ability to do a whole ton about it. But if a patient's admitted to us and we're kind of doing their assessment. I mean, we have total care of them throughout the day, so we see different changes in behavior patterns. If we suspect any drug abuse, the first thing I do is talk to the provider and tell the provider my suspicions about prescription drug abuse. Oftentimes, the provider will then go see the patient, talk to the patient about their medication use. Hopefully, when they were first admitted, we kind of got a list of their home medications, but oftentimes they'll lie about it. So, the provider will ask more questions about their medication use. Um, and then we can if we really think there's an issue, we can get an order to have their room searched. And I've actually done that before because we can't legally go through their stuff, but if we have an order to do so, then we can have security come up and go through their stuff. And that's how, with the previous patient I had that wasn't really arousable, I got an order, and we actually found the empty bottles of medication in her bag. Um, so I don't think, as far as what we should do, definitely talking to the provider, talking to the patient, the social worker, the case management, and kind of all working together to devise a plan for this patient. You have to be careful because you don't want to take all the medication away. You don't want the patient to withdraw. You need to kind of still give them, pain medication if needed, but on like a healthy schedule ordered by the physician. And as nurses, we definitely need to be monitoring that patient for withdrawal effects and actually scoring them. We score them in the hospital based on like where they are in the withdrawal process, and then we kind of act from that. Like, for example, Ativan is one of the drugs we use for withdrawal, PRN. Just as an example. So it's important for us to contact people and to monitor our patient are the two big things I would say. And then if a patient scores a certain number, then like over 8, I think it is, then we contact the physician again and go to plan B. Um, it's definitely crucial that we have social work and case management involved so that we come up with a plan for either inpatient or outpatient rehab or management if that patient is willing to get help. By doing those things, we're definitely keeping our patients safe in their best interest in mind, which is our responsibility as caregivers to provide the best care we can to our patients. So after we found that empty bottle of medication in my patient's bag and found out she had taken the whole bottle and she was dishonest with us, we ended up giving Narcan to reverse the effects of the medication for her. And then afterwards, that kind of happened really quick. I talked to the provider and the social worker, and they kind of came up with a plan for her. She was willing to get help, so we sent her to get help for her addiction, but it kind of took that incident for her to realize I really need help to where she actually about stopped breathing. Um, I've had actually a few patients who I've kind of encountered this with, um, and I think 2 of them I sent to the ICU because of it. So now, whenever we admit a patient, either me or the pharmacist or pharmacy tech are really careful to ask specific questions about what they take at home, how much, what it's used for, to kind of get the most honest answer that I can so I don't come across this situation where a patient has overdosed in my care using their home medications. I think if a patient understands the importance of being honest about this stuff, that they would realize how much of a benefit it is to them, for sure. So I think those were all of the questions for this week's blog. I really enjoyed reading about this stuff, especially because it's something I encounter a lot at both my past and my current job. So I think a lot of nurses do encounter these situations, and it's really important for us to know um, how to handle them and how to keep, instead of just getting aggravated with our patients, how to keep their best interest in mind and how important it is to really get them the most appropriate care. And that is it. Thank you.